and in emergency situations. When an inmate first enters the Federal Bureau of Prison system, before you even get there, people that you've never met at the Designation and Sentence Computation Center, they're going to determine the defendant's information, including your criminal history. They're going to evaluate it, your offense and sentence and medical documents and treatment history from your pre-sentence report, input it into what they call Sentry, which is their software to determine both security classification and medical care level designation for that inmate. Designations range from care level 1, which is going to be for the healthiest inmates, to care level 4, which is the equivalent of a hospital level care for gravely ill inmates needing inpatient care, which is essentially those needing 24/7, 365 nursing care. An institutional designation is then determined based on the medical care level and security classification level. Don't just say that you want to go to a care level 4, which is a federal medical center, which is 24/7, 365 nursing care, because they house people of all security levels, both violent and nonviolent. So it's not a walk in the park if you don't have to be there. Final placements decisions for those inmates with significant health conditions and concerns are made by the Office of Medical Designation and Transportation at the BOP. Getting into specifics. Care levels of the BOP, care level 1. This is going to be comparable to a general practice physician that one rarely visits, or you visit for the occasional minor illness or injury. This is going to be for inmates who are less than 70 years old with limited medical needs. They have a stable mental, and physical health, typically need physicians no more than once every 6 months. Any mental health crisis would be of short duration and would not require hospitalizations. Examples of limited medical needs assigned to care level 1 will include mild asthma, diet-controlled diabetes, stable HIV, or AIDS for which medications are not needed. A community hospital is usually approximately 1 hour away from a care level 1 institution. And then you can see here, I have a table to the right here of BOP care level 1 facilities, and they're grouped by security level. Most federal prison facilities are designated next to be care level 2 because care level at this level is the majority of people, both in society at large, as well as for people within the BOP. And these are going to be your normally fully staffed internal medicine practice. Inmates are designated to a care level 2, will have chronic illnesses that require or may require medication, but their health is generally stable. Hospitalizations are usually not required. Inmates at this level may have a mental health diagnosis requiring routine outpatient care, but all mental health concerns are controlled with medication or talk therapy. Medical or psychological patient care visits may be available monthly to quarterly. Care level 2 facilities are within 1 hour of a regional hospital center, but the need for hospitalization for such an inmate would not be expected more than every 2 years. And again, we have a table there's table 2 that we'll see on the next page. Care level 3. Care level 3 facilities are located near major community medical facilities to ensure outside necessary medical care is within close proximity to the designated institution. Care level 3 inmates include those needing companions to help with their activities of daily living, but not needing daily nursing supervision, which means they don't need nursing care 24/7, 365. and those needing daily to monthly medical or psychiatric visits. Other care level 3 inmates, including those suffering from cancer in remission, less than 1 year, advanced HIV or AIDS, severe mental illness in remission on medication, congestive heart failure, and end-stage liver disease. These inmates may have chronic or recurring mental illnesses or ongoing cognitive impairments. Daily inpatient nursing care is not available, but inmates at this level may require hospitalization periodically to stabilize their medical or mental health care condition enough to keep them from deteriorating to the point requiring round-the-clock nursing. And again, their care level 3 facilities are grouped by security classification. Now we're going to go on to care level 4. These are known as medical centers for federal prisoners or federal medical centers. They operate like small hospitals and provide varying degrees of nursing and medical care, including surgical, diagnostic, and therapeutic services. They are the only BOP or Federal Bureau of Prison facilities able to provide this type of care level 4 inmate with the around-the-clock nursing care needed. Let's get through here where you see all the different facilities in this tables. For the medical or chronic mental health condition resulting in severe physical or chronic impairments. Physical ailments designated to this level include end-stage kidney failure requiring dialysis, unremitting cancer, quadriplegic, stroke, debilitating neurological trauma, major surgery or high-risk pregnancy, and recent transplant recipients within 1 year. Mental health diagnoses so severe that an inmate cannot function in general population may be designated to a mental health unit within 1 year of the prison medical facilities. Care level 4 facilities accommodate inmates of every security level, which makes the safety of nonviolent offender an issue to be raised. And again, you can see the tables here, and they're available on the website with links to this, as I showed you earlier, to this specific article.